My name is Andrea Fields. I am a trauma nurse at Carolinas Medical Center in Charlotte, North Carolina. I come into contact with a lot of different patients that have a history of polysubstance abuse. Furthermore, I deal with a lot of patients that have disease progression due to opioid use. There are over 1.7 million people that struggle with substance abuse use. I have recently been in a collegiate debate about House Bill 325, the Opioid Response Bill. This bill would elicit funding for a syringe exchange program, as well as a decrease in the restrictions on providers providing patients with Subutex. The number one argument that I have found against this program is the fact that it would cause a big financial burden on the government. However, the number one reason that I have found that this bill should be supported is that it would decrease on bloodborne pathogen transmission in patients that struggle with substance abuse. This bill is currently in the signing stage by Governor Cooper. I have chosen that this bill should be supported for several different reasons. Number one, the decrease of transmission of bloodborne pathogens. Cities that have elicited this program have seen a decrease in HIV as well as hepatitis C. Furthermore, this program would allow for proper disposal of syringes. This would protect not only healthcare workers, but law enforcement and the public as well. Lastly, there is over 130 opioid deaths per day. This number is actually more than motor vehicle deaths in the United States each day. This program would allow for testing of opioids. A lot of opioid deaths is related to the fact that these drugs are laced with harmful substances such as fentanyl. This would decrease the opioid deaths in the United States and North Carolina. I feel that this bill should be signed by the governor and it should be implemented quickly into our legislation. There has to be something that can help with the opioid war in the United States, and I think that this bill would be a great addition to legislation in the United States. I also believe that healthcare workers can be a great investment in this bill through using the resources that we have available to us. We can educate and help these patients get better. Thank you and have a great day.